Hello, it's Dr. Rhonda Johnson. Today is Thursday, April 18th, 2024. My topic today is our nation's global health security strategy. Now, on April 16th of this week, the Biden-Harris administration made public their new strategy to address global health threats. Folks, we have to realize that with the most remote place on earth, diseases can travel fast and reach the United States in just 3 days. So our nation has a new plan called the Global Health Security Strategy to help stop the spread of diseases from around the world. Now, this strategy aims to make sure that we can find, stop, and deal with these diseases quickly. It's a 5-year plan highlighted in a 60-page document. I'll be sure to include the link. And just know that I'm giving you a very simplified version of this document today. So here's what the plan includes. It wants to make better use of health programs that already are in existence, like those that deal with serious diseases and health systems. It aims to improve programs that help people during disasters and make sure that there's enough food, clean water, and hygienic supplies available. The plan also wants to gather and use health information from sources that monitor diseases and people, animals, plants, and the environment. And lastly, it will strengthen the research on these diseases and how to treat them around the world. Now, this whole effort involves enormous amounts of coordination between intergovernmental agencies, health organizations. There are legal agreements. There's 50 nations that the plan aims to have strategies with, and it involves getting all the money needed to make it happen. Now, the president is supposed to have someone in charge of making sure this strategy is implemented. This is a big effort. It's important, I think, to make sure that healthcare is fair and reaches everyone, especially the most vulnerable people who need it during a disaster of any sort. Now, it's a complicated process, and I am not an expert at reading government strategy or policy documents. I've never worked for the federal government, but I've worked for county and city health departments and city governments, and have participated in national public-private sector health collaborations. So I know how bureaucracy works when it comes to government-sponsored health care. So that's the first question I wanted to know when I read the document, was who was accountable, like the buck stops with who. So I'm still not sure, but it mentions that the president will designate a United States Global Health Security Coordinator at the National Security Council level for global health security and biodefense. This person will lead the interagency Global Health Security Review Council, but I'm not sure if they lead all of it. It says the coordinator will lead the departments and agencies through a whole of government approach to implement the strategy and associated policies and activities. So I guess we'll just have to stay tuned. Now, I think this is very important, and I commend the Biden-Harris administration for developing a strategic plan, because we certainly know that the COVID-19 pandemic caught the world in a place where few governments were prepared for the magnitude of a public health response that was needed. We will never forget the lockdowns. We will never forget the shortages of testing equipment, of food, people declaring bankruptcy. It was a disaster of its own kind. So this is needed, it's necessary, and hopefully they will be successful. So that's my message today. I'm going to take some time away just to refresh, restore, rejuvenate, etc. And I'll see you guys sometime next week.